Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I have a segment called Ask Dr. A. You can ask me any question you want as long as it's relatively related to dentistry-ish orthodontics. So I got this question and I'll be glad to answer it. So it's asked by a dentist. What is the standard practice for retainer modifications after a new crown is delivered? Just delivered a crown on a patient. Now she wants to come back and have me fix her Invisalign retainer. I'm assuming they're talking about a Vivara. Invisalign retainer equals Vivara, which is a brand of retainers made by Invisalign. I'm happy to adjust it. Yeah, you can adjust a Vivara to hopefully get it to fit fine. Now that won't happen. All you'd be doing is trimming that part off of it, which will make any other adjacent tooth or that tooth extrude. So you can't do that. However, she's a very difficult patient, and if she tries to request the whole thing to be remade, I want to know what standard practice is. Standard practice is anytime you do a crown, a restoration, a bridge, an implant, anything, filling, you should know which one of your patients has had ortho treatment. Even if you didn't do it, and if not, you just ask. Every time you do any restoration at all, be it an amalgam, a composite, you say, hey, by any chance, do you have a splint, a sleep appliance, or a retainer? Obviously, if it was delivered by you, you should know that. If it wasn't delivered by you, you should still ask. It would be a good idea for you to go back to whomever did the orthodontics and see about getting a new retainer after this, because your other one is probably not going to fit properly. They can go back to their doctor. If they say, oh, this was in another state, another country, then you can say, all right, I'm happy to do an additional retainer. Let's talk about options. Then you need to talk about what the cost would be. Obviously, your cost for the lab fee, your cost for the scan, your cost for the delivery, and if it includes any retainer follow-up appointments or not. If it doesn't, then you need to have some type of statement saying so-and-so office and doctor is not an orthodontist, is not responsible for any orthodontic relapse. I would have that. Just kind of a standard form saying that you're going to be replacing a retainer due to request, but you're not going to be responsible for any orthodontic relapse or shifting that occurs. That's exactly what I would do. Obviously you're going to charge them. I would say, if a Vivara is lab fee around $300 for a set of 4 upper, it's a fair amount. So, you can go to any ortho lab and just order a retainer. It's going to be a lot less, $50, $60. I don't think I would charge something ridiculous if I was doing the restoration. I think I'd charge whatever my cost is plus a little time for delivery as well. So maybe $100, $150. But if you're going to be doing retainer checks, then it should be higher, right? Obviously, if the teeth are not straight, well, then is it a good idea to trap them like that? Or is it better to consider to do some more ortho? So this is where you need to understand, okay, if I trap them in an Essix, what is the risk? What are the benefits to doing this? Yes, they'll stop shifting aesthetically, but is the bite worth trapping? And that's where you have to have some orthodontic knowledge. If you do not, then you need to send them to an orthodontist to have an evaluation or work with an orthodontist to understand this a little bit more. But certainly I would upcharge them a little bit for your time, and it could be an opportunity to make some additional revenue for your practice. So yes, no, the new retainer should not be included in the crown delivery. It's an additional fee. And it's an option to the patient. They can get it done with you, or they can go to an orthodontist to get it done. All right, thanks so much.